assessment test of muscular strength for the old age group.
The key topics include importance of muscular strength for elderly, benefits of muscular strength, different types of assessment tests, comparison of tests and recommendation, and conclusion and evaluation. The importance of muscular strength in the elderly. As we age, our muscle mass decreases. The elderly need strength training more and more as they grow older to stay mobile for their everyday activities. The goal is to reduce the loss of muscle mass and resulting loss of motor function. Strong muscles improve balance and decrease the risk of falls. This can reduce age, pains, increase an overall sense of well-being. Also, strength training can help to reduce the common symptoms such as diabetes, obesity, back pain, and depression. Also, it can increase the functional independence. The muscular strength is essential for daily activities like walking, climbing stairs, and carrying heavy objects. It also can prevent falling. Stronger muscle can improve balance and coordination, lowering the risk of falls and fatal injuries. It also improves quality of life. Muscle mass and strength enhance the physical and mental well-being of elderly, reducing the likelihood of chronic disease.
Benefits of muscular strength. Being strong helps reduce the risk of falling, increase muscle mass, improve strength, improve quality of life, improve functional abilities, increase level independence, reduce the risk of a number of age-related diseases, heart disease, and type 2 diabetes, improve sleep quality, decrease level of depression and anxiety. Training of muscle can increase bone density, overall strength and balance, strengthens bones. Staying active keeps joints healthy. Benefits of muscular and strength, and also improve balance and fall prevention. Stronger lower body muscles increases stability during standing and walking, improve stability and balance. Enhanced core strength, supports proper alignment of the spine and pelvis, supports posture and reduce to fall. Maintenance of independence, easier daily activities, reduce fatigue during tasks like grocery shopping, cleaning, or gathering. Strengthens muscles, makes daily activities easier and less tiring. Prolong the ability to live independently without relying on caregiving or assisting.
There are the 4 assessment tests for elderly. The first one is walking test, the second one is chair stand test, and arm curl test. The last one is chair, sit, and reach test.
Walking test, time the up and go test, raise from chair and walk regular pace for 3 meters and then turn around and sit down. 6-minute walk. A time the walking test, step in pace test to assess the aerobic fitness for those who cannot walk freely.
3 meters time up and go test. Method: Patient wear their regular footwear and can use a walking aid if needed. The patient start in a seated position and stand up upon therapist's command. Walk 3 meters. Turn around, walk back to the chair, sit down. The time stop when the patient is seated. Be sure to document the assistive device used.
And then is the 2-minute step up in place test. It measures the points that is halfway between the midpoint of patient patella and the top of the iliac crest. Then measuring how many times he can the right knee reach this point while marching the place for 2 minutes. The person with reduced balance may use a table or a chair for stability. Higher scores indicate greater level of aerobic capacity. To assess the aerobic fitness for those who cannot walk freely, and the equipment is required, such as stopwatch, tape measure, and the tape. The advantage of walking test: it is easier to administer and simple to perform. It is functional and real-life relevance. It can reflect real-life mobility and endurance. It also can maintain the independence of elderly. It can evaluate multiple health dimensions, such as aerobic capacity, lower body strength, and balance and coordination.
Chair stand test. Place the chair against a wall or otherwise stabilize it for safety. The subject sits in the middle of the seat with their feet shoulder width apart, flat on the floor. The arms are to be crossed at the waist and held close to the chest. From the sitting position, the subject stands completely up, then completely back down. And this is repeated for 30 seconds. Count the total number of the complete chair stand. Up and down equals 1 stand. If the subject has completed a full stand from the sitting position when the time is stopped, the final stand is counted in the total. Advantage of the chair stand test. The test specifically targets the tricep, hamstring, and gluteal muscle, which are essential for standing up from a seated position, use the stairs, walking, and maintaining balance. Strong lower back muscles are critical for maintaining independence in daily activities. Also, it can also predict with poor performance on the chair stand test, like fewer repetition or longer compression times, is associated with weaker lower back strength, reduced balance and stability, and higher risk of falls, which are a major concern for elderly individuals. Early identification of fall risk allows for timely intervention, such as strength training or balance exercise. Arm curl test.
Arm curl test. Seated in a chair holding a weight. Woman for 4 pounds and men for 8 pounds. Use the arm to bring through the range of motion. To complete as many curls through the entire available range of motion in 30 seconds.
Advantage of the arm curl test. The test specifically measures the strength and endurance in the bicep and forearm muscle, which are crucial for performing everyday activities like lifting objects, carrying bags or light loads, reaching the items, opening drawers, doors, or containers. Stronger upper body are essential for maintaining independence in daily living. Predict independence in activities of daily living. The arm test help assess whether an elderly individual has sufficient strength to complete tasks like dressing and grooming, lifting and carrying objects, performing basic chores. Poor performance may indicate a higher risk of losing independence and requiring assistance in daily life, which is also quick and simple to administer. The test is easy to perform and task only takes 30 seconds to complete. It requires minimal training for administrator, making it accessible for the use like in clinic setting, community centers, or even in home assessment. Chair stand, chair sit, and which test. The subject sits on the edge of a chair, placed against a wall for safety. One foot must remain flat on the floor. The other is extended forward with the knee straight, held on the floor and angle bites at 90 degrees. Place one hand on the top of the other with the tips of the middle finger even. Instruct the subject to inhale and then as they exhale, reach forward toward the tools by bending at the hip. Keep the back straight and head up. Avoid bouncing or quick movement, and never stretch to the point of pain. Keep the knees straight and hold the reach for 2 seconds. The distance is measured between the tips and the fingertips and the tools. Advantage of the chair sit and reach test. The test directly measures the flexibility of the hamstring and lower back, which are essential for walking, to use the stairs, bending to pick up objects, maintaining balance and posture. Reduced flexibility in these areas can lead to stiffness, limited mobility, and an increased risk of falls, which can also predict functional mobility. Lower back flexibility is crucial for performing daily activities such as getting in and out of a chair, car, or bed, reaching for objects on the floor, dressing, like putting on shorts or suits. Poor performance on this test may indicate difficulty with such tests, which could be compromised independence. Furthermore, it can also identify risk of falls. Tight hamstring and limited lower back flexibility are associated with decreased balance and mobility, increasing the likelihood of falls. By identifying flexibility limitation, the test can guide the intervention to improve range of motion and reduce fall risk. Comparison of the test and recommendation. 3 meters time up go and go test, which can assess mobility and fall risk, which is also recommended for older adults with mobility concern. 6-minute walk test. It can evaluate aerobic capacity and endurance, which is recommended for older adults with chronic traumatic condition. 2-minute step-in pace test. It can test lower back strength and endurance, which is recommended for all elderly population. Chair stand test. It can measure lower back strength to the elderly individuals needing strength evaluation. Arm test. It can assess upper body strength for older adults focusing on upper body functionality. Chair sit and reach test. It can evaluate flexibility for all adult population.
The comparison of test and recommendation. The assessment test of muscular strength for the old age people is elderly care. It is to provide support and assistance to elderly to help them with daily activities, health management, and maintaining their quality of life. The exercise can improve their mobility. It can enhance their balance, reducing the risk of falls. Also, it can strengthen their muscle, maintains muscle mass, and improve overall strength. It also can help with mental health. It can reduce symptoms of depression and anxiety. Also, it improves cardiovascular health. It can lower the risk of heart disease and maintain a healthy blood pressure. Lastly, it can encourage independence. It can help elderly to handle daily activities more easily. The safety consideration for the medical clearance, we should be aware of any chronic health issues such as heart disease and make sure we can have time to respond and coping. And for environment, we should ensure that the environment and the equipment of test is safe and clean for old age people to make sure not having any accident, such as falling down or twisting ankle. And be aware of the warm up and cool down. We should make sure that our participant is having a good warm up for make sure they don't hurt themselves, such as muscle strain. Lastly, hydration and rest period. We should schedule some rest period every 15 to 20 minutes to ensure that participant is having enough rest time and prevent heat exhaustion.
Challenge in assessing elderly. Health conditions. Elderly often have multiple chronic conditions such as arthritis or heart disease, which may affect their muscle strength and the result of the exercise. Pain and discomfort. Elderly may got muscle and joint pain that may affect the process of the exercise and the results. Lack of motivation. Elderly may lack of motivation that make them not doing the exercise seriously. Subtlety of assessment. Some tools are too hard for older elderly to use. That may affect the result of the assess.
In conclusion, taking care of the elderly involves a multifaceted approach that includes physical, emotional, and medical support. Regular exercise plays a crucial role in enhancing the quality of life, improving mobility, and in reducing the risk of health-related issues. Utilizing various functional tests can help tailor exercise programs that meet the specific needs and capabilities, ultimately promoting healthier aging in order to make sure that the elderly is happy and healthy by promoting exercise for them to follow so that it can act as an injury prevention.